We head back to Missouri now as President Obama and Mitt Romney have battled over the Affordable Care Act. You may not be aware that if you live in Missouri, you'll be deciding the issue of health care on the ballot Tuesday. If approved by you, Proposition E would block the governor or any Missouri agency from creating a state health exchange without approval from voters or the legislature. So what happens if you vote yes on this measure?
Well, if you vote yes, the governor cannot set up an exchange. And I think this is a reflection of Missourians' distrust of Obamacare. They don't want these state exchanges, and this is a way to send that signal. Now, if he doesn't set up the exchange and Obamacare does keep rolling along, ultimately the federal government would set up the exchange.
And so what? If the federal government sets up an exchange, don't you still get the same benefits as you would under a state health care plan?
The way the law is written, you would still get the same benefits. However, it's estimated 23 million people will get their insurance through these exchanges. The way the law is written, only people who purchase their insurance through state exchanges are going to get the subsidies. About 18 million of those people will qualify for subsidies to make their health insurance less. The law isn't clear that if you buy it through the federal exchange, you'll get those subsidies. So what happens if this passes in Missouri? Missourians likely will pay higher premiums for the insurance, just like people in Kansas are going to. And nobody's talking about this. The IRS says they can fix it, but I guarantee you, if they try without legislative change, they will get sued. Missourians in Kansas are about to pay more for their premiums.
Stacey's right. There is a dispute over how these exchanges will work, federal versus state, although it isn't clear how that language would work. And let's face it, the Affordable Care Act is bringing lawsuits all over the country. So the real question is whether Barack Obama or Mitt Romney is elected and what happens on the national level. If it appears that the Affordable Care Act will proceed, my guess is that the state legislature will give a hard look at establishing its own exchange independent of the federal government. That's a big if, but that's my guess, only because I think they'll want to have more control over it than just ceding it to the federal government. I could be dead wrong. It could be a very doctrinaire, very polarizing argument, but my guess is that's what they'll do.
Well, the problem is they have to submit their plans by November 16th, and Missouri has already pushed off a lot of federal money that would have helped them to do this.
And Kansas as well.
And Kansas as well, even to upgrade the computers that they would need to do the electronic information gathering. So Missouri, unless the federal government moves that deadline back, they're not going to be able to meet that deadline. And so in the short term, there will be no exchange.
But we did a panel on this station where you can apply every year to do a state exchange. So even if they don't do it this time around, you could apply again a year from now, but it doesn't mean the political climate would change in Missouri and that they may not want to do that.
Right. We'll just have to wait and see what happens.